Thank you for joining us, everyone, on this cold winter's day for our Quality Improvement Lunch and Learn webinar on increasing uptake of cervical screening rates at your general practice. My name is Angela Heathcote, and together with my colleagues Barb Repkin and Julie Allardyce, we welcome you today and thank you for taking the time out of your lunch break to join us. I would like to start our session today with our acknowledgement. Eastern Melbourne PHN acknowledges the Wurundjeri people and other peoples of the Kulin Nation on whose unceded lands our work in the community takes place. We pay our respect to Aboriginal and Torres Strait Islander cultures and to elders past and present. MFIN is committed to the healing of country, working towards equity in health outcomes and the ongoing journey of reconciliation. We recognise and value the knowledge and wisdom of people with lived experience, their supporters and the practitioners who work with them, and celebrate their strength and resilience in facing the challenges associated with recovery. We acknowledge the important contribution that they make to the development and delivery of health and community services in our catchment. So today's session, we're going to be looking at some key areas to help support you in your practice with increasing cervical screening rates. So we're going to start by looking at a case study scenario outlining the activities that they completed to increase screening rates at their general practice. Implementing cervical screening quality improvement activities will step you through some of these activities to increase the uptake and accurate recording of screening, including self-collection. The importance of integrating the National Cancer Screening Register with your clinical software and implementing processes to accurately record cervical screening results and track improvement progress. And finally, identify eligible people with a cervix aged 25 to 74 due for cervical screening in your practice using POLAR. I'm going to firstly pass over to Julie to give us some background and context as to the importance of this work that we're working on with you. Thanks, Julie.
Thank you, Ange. Afternoon, everybody. The World Health Organization officially launched the global strategy to accelerate the elimination of cervical cancer in November 2020. Australia has answered the call to develop a national elimination strategy that includes achieving a 70% screening rate of eligible people aged 25 to 74 years. Modelling suggests that with HPV vaccination and HPV-based cervical screening, Australia can achieve the WHO's global strategy goal to eliminate cervical cancer as a health problem by 2035. The largest national cervical screening program seen in 20 years is set to kick off in September this year. This webinar will provide you and your team with some valuable tips and ideas to increase the screening rates at your practice. Thanks, Ange. Self-collection now provides eligible people an option to take their own sample for cervical screening under the oversight of the clinician. This is such an important option that can be implemented to improve accessibility and participation in the cervical screening program. The national campaign will be targeting priority populations. General practices are in a position to consider their never screened or under-screened patient populations to ensure that there is equitable access to information and offer culturally safe and inclusive screening services. Thanks, Ange. From the Australian Institute of Health and Welfare Cancer Screening Program quarterly data, MFIN catchment cervical screening rates record that 66.5% of eligible people have a completed screening test. This is the second highest PHN nationally, but PIP Quality Improvement Measure 9, which is the proportion of people 25 to 74 years of age with an up-to-date cervical screening test recorded in their GP record within the previous 5 years, is only at 43%, which indicates cervical screening is not being consistently recorded in the practice's clinical information system, therefore making it more difficult for your practice to easily identify those people who have never screened or who are under-screened. And our connection to the National Cancer Screening Registry is also low, with only a 36.8 connection rate for practices in the MFIN catchment. Therefore, again, not providing your practice teams with an easy and quick way to access up-to-date screening information. Thank you, Ange.
Thanks, Julie, for that background. So we thought before we go through some of the tips today that we would actually provide you a bit of a case study on one of our practices that we've been working with. So on behalf of Deb, the practice nurse at Dr. Dan's Medical Clinic, I would like to provide you an opportunity to hear how their clinic are on the path to reaching their goal for PIPQI Measure 9 of 90% completed cervical screening rates. So Dr. Dan's Medical Clinic is a small clinic up in Monbulk, and until recently had to function for the majority of the time as a solo male GP clinic, which in itself created some barriers to screening. They opened their doors during lockdown in 2020, creating more barriers, and as a result had some inefficient reminder systems due to merging of patient data, new patients, and obviously as a result of the pandemic barriers. So Deb and her team highlighted and said that one of their goals was to reduce the amount of time it was taking for the team, especially the nurses, to accurately identify underscreened patients, including what type of cervical screening they require, and where possible promote self-collection as an empowering, easy and less invasive option. So the team at Dr. Dan's clinic started their improvement journey last year and had already implemented activities that had led to increased screening results. They knew they were doing a good job and wanted to identify further improvements to assist in improved practice data and sustainability workflows. The team mapped their practice workflows to demonstrate their barriers and areas for improvement to identify eligible people for screening. So this was a great activity where the team got together. So it was their practice nurse, their GP, their receptionist and practice manager, put up big, large pieces of butcher's paper in their tea room. And using post-it notes, the team mapped through what they had completed so far and identified what were some of their barriers and the ways that they actually achieved some improvements for that. The mapping was left up on the wall in the tea room for a week to allow the staff members to make changes and updates as needed. And the activity provided an opportunity for them all to brainstorm together further ways to solve issues and new areas for improvement that supported increasing their data quality as well as sustainability actions. So this slide here just shows quickly some of the game changers that the team found were really significant in increasing their screening rates and also the confidence of the team in offering self-collection. One of the biggest things that Deb highlighted was for the nurses that they completed the cervical screening training that's now available, and it gave them the ability to accurately and confidently answer questions and optimise uptake of self-collection with their patients. The biggest game changer for them was the integration of their clinical software with the National Cancer Screening Register. Deb had talked about how long it was taking for them to take multiple time to go through looking at patient lists and trying to find as to whether they had been screened or not screened. And it was taking a long time for the team to do that. And as soon as they connected to the National Cancer Screening Register, they were able to update their lists accurately. Earlier this year, the team also involved an activity with a first-year medical student where they undertook a quality improvement research project, which validated what they were doing and that they were doing a great job, and that self-collection had made a significant impact in addressing barriers for their never screened and underscreened people. Involving a medical student also as part of their QA activity address those ongoing issues of when you're actually undertaking quality improvement activity, allocating that protected time for your team and for the nurses to go through lists. And so the medical student was able to complete some of these time-consuming tasks, therefore alleviating some of that stress on the team. And the biggest and final step that the team completed was obviously understanding the accurate recording of their cervical screening results in the CST field in the practice patients' data. This you can actually see on this graph here from May through to June had a significant increase in their data, which now reflects their improvement efforts. And it also is supporting the sustainability actions going forward. So when they future look at their patient lists, they know that they've actually got accurate lists. And also they're going to take these learnings and use them towards their next improvement area, which is on bowel cancer screening. So as a result of the work that we did with Dr. Dan's clinic, we have a wonderful resource that we've developed in the Quality Improvement Toolkit for General Practice, which is going to provide some valuable tips and ideas, which we're going to step through with you now, as to some things that you may consider doing at your practice to increase screening rates. So the overall goal of the activity is obviously to increase uptake and accurate recording of cervical cancer screening with a focus on self-collection, and looking at those screened, under-screened and never screened patients through self-collection and those priority patient groups. The measurement to use is that we're looking at the PIP-QI Measure 9, which is easily accessible through Polar, which Barb is going to step us through shortly. And some of the change ideas or the ideas that you may consider at your practice will go through in the 5 steps, which are identifying areas for improvement, getting your data ready, getting your team ready, getting your practice ready, and strategies for improving participation in cervical cancer screening. So obviously these ideas are just some tips and ideas, but you can decide as to which ones are relevant to your practice. Increasing your practice patients' cervical screening rates, it may take numerous PDSAs and PIP quarters, so obviously consider the time that it will need and reflect that in your goal as to the time frame that you want to do your work in. Determine how your activities will be sustainable into the future. Like Dr. Dan's clinic, they wanted to make sure that they had implemented activities to ensure that if they were to pull out a list in 6 months' time, they could be confident that the list was going to be up to date. And most importantly, ensure that you involve the whole of practice team in your processes, including them in your brainstorming ideas can actually help alleviate some of your barriers that you may have at your practice. So the first step that you may consider doing at your practice is like what Dr. Dan's clinic did, where they actually mapped out their practice workflows or their patient journey. From that experience, it allows everyone to contribute to finding their role in the practice, but also pinpointing, as we said, any obstacles or the issues that you can overcome and areas for improvement. So there's some simple steps there to, organise a session with your practice team. It only took an hour for Dr. Dan's team to do this activity. You might illustrate each of the roles in your practice in what we call a swim lane map, so easily identify who does what and when. Allocate each step into the relevant team member to demonstrate the flows between the team members. You can map and consider who and how you actually offer screening. You can highlight the barriers to screening and what steps are needed to address these barriers, and also identify some of the practice processes and systems to support your screening, such as your recalls and reminders, your rooms used, and appointment systems. I'm going to pass over to Barb now to step us through looking at getting your data ready before implementing any of your activities. Thanks, Barb.
Thanks, Ange, and good afternoon to everyone today. Before you begin any quality improvement activity, we recommend that you have implemented data cleansing activities. And for this activity, at a bare minimum, I'd recommend that you make patients inactive who's not been seen at your practice for a number of years. And it's a fairly easy process to do in both medical director and best practice as a bulk inactivation. I know a lot of people stress about recalls and reminders added to patient files, but in actual fact, there's a built-in process that if the patient has an active reminder, the reminder that will remain in the system and still be able to be used. And we'll be sharing resources today on how to do this. You'll see a little bit later on that one. The other thing is to connect to the National Cancer Screening Register and update your patient's cancer screening details. A number of patients will have had their cancer screening completed outside of the practice, and so therefore it makes our data inaccurate. So you need to update your patient's records to reflect this in the cervical screening table in your clinical information system. And the register, the National Cancer Screening Register, actually provides a lot of free support to integrate clinical information systems, and we'll be providing, the contact details are on this slide to be able to do that. You can always contact us and we can put you on the right track as well. And it's very important that your providers are recording results in the correct place in the clinical information system, and not just adding them to results. They need to be added to the cervical screening table, which is a fairly easy process to do from the holding file or the inbox when actioning the results. And the providers can actually go in and retrospectively add the results to the CST field from the results in the patient record. Thanks, Ange. These are just some train IT resources. We'll be providing them to practices today on how to add cervical screening results in both best practice and medical director. And in the next slides, I'll give you a brief overview of how to add those results. Thanks, Ange. So recording screening and best practice can be done when actioning the results in the inbox. From the inbox, the providers need to use the option of adding, and it's a bit small, but you can see a round circle down the bottom. You can add the C to the CST. You can add the CST result option, and this will open the cervical screening, as you can see up the top. And this is where Polar is actually picking up the data from. Next slide, please, Ange. So you can add the result also as, which is what you should do. You should add the result as recorded as not performed here, if this is the case. This is also where you can add no longer requires cervical screening, or you can opt patients out of cervical screening if that's what the patient wants you to do. And this, just to note, this is where you will update your information that you're going to source from the National Cancer Screening Register. If it hasn't been performed in your practice, you will also be, even if it has, you'll be adding through best practice cervical screening results this way. Next slide, please, Ange. In Medical Director, in the holding file, the providers need to select the result and then right-click, and you can see the option there. As long as it is a cervical screening result, you will have the option of adding the cervical copy the cervical screening results into the cervical screening table. Which is quite an easy thing to do, and the table will come up and it will be pre-populated, and all you need to do is click on add, and this will add it automatically for you. Next slide, please, Ange. Or you can do it also in the patient file. You can select the cervical screening tab, use the plus symbol up the top left-hand side and add results that way. You also have the option of excluding patients here from future cervical screening prompts or recalls. And the cervical screening result will open, and from here you can add the details. You also have the option from here of adding a recall or reminder. And we're very pleased to be able to offer free software training for practice staff and GPs with a live demonstration of how to add the cervical screening in both Medical Director and Best Practice in June, July and August. I think we kicked the first one off for Best Practice GPs next week. And so we'll provide a link for you to register for those at the end of the this presentation. But if you can encourage your GPs to come to that, they will be covering the cervical screening in that. I'm going to hand over to Ange now. Thanks.
Thanks, Barb. So the third step that you may consider as part of your journey, and which is what Deb from Dr. Dan's clinic said was a big game changer for her, was there is fantastic training available for practice nurses and GPs to increase your knowledge and skills to offer self-collection. So the Australian Centre for Prevention of Cervical Cancer provide free online CPD training, and the link is there available for you. The other option is that if you didn't attend our webinar that we held last week, we had Dr. Starkey from the Australian Centre for Prevention of Cervical Cancer and also Dr. Dan presented at that webinar, which gave some fantastic insights and tips and also some case studies, which was of use as well. The other valuable resource for your clinical teams is also the use of Health Pathways Melbourne. Our colleague Crystal has been fabulous to create a cancer screening pathway demonstration. So it's a YouTube video there. You can actually click on that video and she demonstrates all the different steps and processes through that pathway. Obviously, there's a link there as well for you if you want to directly go to that link. And we've got information at the end of this presentation if you would like to gain access to Health Pathways to reach out to our teams. The third step is looking at getting your practice ready. So what potentially do you need to maybe review what you currently have in place just as a team refresh, which you may do as part of that first activity where you're looking at your processes and systems together. So do you need to have a review of your current recall and reminder systems? Are patients receiving that accurately and up to date in a timely manner? Looking at your patient bookings, are they of the right length of appointments? Do you have the right available rooms for the right people in your clinic? General practice setup, your connection to a pathology provider that provides self-collection. Do you have your self-collection kits available in each of the rooms to allow for those opportunistic times that you may be able to offer it to patients? And have you got your patient resources available for patients to demonstrate how to do a self-collection, so such as posters in the toilets? So there's a link there for that really useful poster that you can pop within your patient bathrooms as well. In the fifth step, looking at strategies for participation in cervical, so addressing patient barriers. So having a look at, there's some fantastic patient awareness and education resources. You can do some practice self-promotion either on your websites, in your practice, or in social media if you have that as well. You've got some fantastic resources there that are available and the link is there. And within our toolkit, we have some fabulous other links and resources as well. The other thing as well to consider in your practice is that opportunistic screening. So obviously self-collection provides a really quick and easy option for patients. Is there a way that you can maybe incorporate that into if patients are coming into your clinic for another reason and you notice on their record that they're actually due for a screening? How could you potentially offer that on the spot, and have you got the systems in place to support that? A great way that I know that Deb and her team mentioned that it was really helped increase screening rates at their clinic as well. Looking at identifying patients who are overdue for screening. So Barb's going to go through shortly with us the utilisation of the PIP-QI clinic report that you can use to identify your patient groups that are due for screening. You may consider selecting a sample or smaller group of patients to break down the process a little bit smaller. So therefore you're targeting specific cohorts, and really consider those patients that may be never screened or under-screened. And looking at your patient cohorts to actually see who has low screening rates. So in the infant catchment, you can actually see on the right there that we've actually got our lowest screening age groups really the 30 to 39-year-olds. So that really fits in potentially with your routine antenatal and postnatal care, looking at those patient cohorts. Obviously looking at your 70 to 74 patients who are exiting the National Cancer Screening Program, they have the lowest screening rates at the moment. Looking at your patients who are currently entering the National Cancer Screening Program, so those patients that are hitting that 25-year-old mark, and then also considering your priority populations, which Julie addressed earlier, the national campaign, which is going to be addressing those priority groups. So you might actually consider as one of your activities, do you have any of those priority populations that you need to consider, and how you could actually address those barriers that may actually impact them actually undertaking screening? So what are some of the enablers that you may consider as your group? And this is something that you may consider sitting down as a team and actually discussing, you know, what and who is self-collection offered to? Is there access to a female GP or a practice nurse? And if not, what other ways can you provide services for those patients? Accessing and using the national interpreter services, local transport options for those that may have issues in accessing and getting to the clinic. Accessible and appropriate information and resources for priority groups in different languages. So in that previous slide where we had resources for patients, there's some fabulous resources available for different priority groups, and the toolkit also has that as available as well. Do you offer some education sessions in different languages for women or refugees and non-English speaking backgrounds on self-collection? Is that an option at your clinic, or do you know of services around you that actually offer that for people with different languages needs? And also culturally and safe opportunities for women with from different backgrounds to book and attend appointments at your clinic. So as I mentioned, the QI Toolkit has steps through a lot of these resources available for you, and also Health Pathways Melbourne actually steps out some fabulous resources that are available for these priority populations. So within the toolkit and also the resources we send out, we're going to send out a sample quality improvement activity, but this is just a simple simplified version one for you that might be helpful for you to step you along in your journey. Stepping out your simplified goals, so you can put in here your screening rates, what you're starting at, your baseline, to what percentage you want to increase to, and also your date that you want to do. What's the measurement that you'll use? So in this case, we're using our Polar PIP QI report, so our Quality Improvement Measure 9. In this activity, we're looking at, they've got a baseline of 55%, and stepping out some of the change ideas here that you might consider in your practice, which some of them are stepped out in the toolkit and what we've just highlighted there as well. With the sample PDSA here, we've decided to look at developing an accurate list to identify people who are overdue for screening. So with your plan, you step out what your prediction may be in doing this activity, how long it might take, and then stepping out and listing each of those activities and who will do what and when. And that will give you an indication as to the timing of how long it might take and what role each person may have in completing these tasks at your clinic. And then once you've actually completed, once you've done the task, have a reflection. Was it actually completed as you had hoped? And then recording and analysing the activity. Did it actually have any impact on changing your screening rates? Was that a significant activity? And is it worthwhile actually continuing with that? And that's at the last stage with your act. Do you actually adopt, abandon, or and in this case, we're adopting the sustainability action because I found that it was important for them to actually, as you can see, actually improve their screening rate numbers for them. So I'm going to pass over to Barb now as to how you and your practice may be able to track your data using the PIP QI Measure 9. Thanks, Barb.
Thanks, Ange. So to find out how your practice is tracking, you can use your practice report. The practice reports are distributed quarterly to all practices, or you can actually request them more often if you're sort of starting that quality improvement activity and it's in the middle of the PIP quarter. You can just email us and we get them monthly, so we'll be able to send you out a practice report. So on page 4 of your practice report, you'll find your practice's screening rate. Sorry, I've got the wrong slide. So that you can see the information on the page about the numerator and the denominator, and you'll be able to see what your numerator is, what your denominator is, and where you're sitting in terms of your percentage, and where you're sitting in terms of the national and the MFIN averages and our top 10 practices. So if you are not receiving your practice report, you can email us on that email below, and we'll make sure, for us it's just ticking a box to make sure that the right person is getting the practice reports at the practice itself. So next slide, please, Ange. So how can Polar help us identify patients who are due for screening? So you need to log into Polar, go to reports, and there are actually a number of ways of accessing underscreened patients in Polar, but the easiest report to use, I find, is the PIP QI report. So select the PIP QI report, and next slide, please, Ange. So this is the overview table once you select the report, and you can see under Quality Improvement Measure 9 right down the bottom, the number of patients who had screening completed. Again, this is your numerator, and the number of patients who are eligible is your denominator. Therefore, giving you your current percentage of screened eligible patients. Next slide, please, Ange. So to select the cervical screening tab, you just select the screening up the top right-hand side. And this will bring up a graph for that quality improvement measure. And from there, you can select the orange box, which says click to select patients who have not been screened and who are eligible. The patient list will load on the right-hand side. And you can print the list by going up the top right-hand side to patient list. And this will give you a list of your patients that are not screened, or more importantly, who do not have their screening recorded in your clinical software. This is your baseline data. You may want to export that patient list. It'll come into an Excel spreadsheet, and you can actually sort it and use some of those suggestions that Anne's was talking about around if you've got large lists. Of course, you want to start looking at your data first, but if you've worked through that process, then you might want to add some age filters in your exported list and work on some of those underscreened age groups. So that's me. Thanks, Anne.
Thanks, Barb. So we've come to the end of our presentation today. I'm not sure if we've got any questions that have come through, Barb, at all for us.
Yes, we do.
Yeah.
No, we don't.
No, we don't have
any questions at the moment. So
no, that's okay. So look, if we do have any questions post today's event, you can always reach out to our teams, which we'll put up our details at the end of the webinar here. We're more than happy to go through that for you. Just as a final go through, if we greatly appreciate your feedback. It's really important that we are obviously capturing the information that you want in these webinars. We do run these webinars each quarter in line with the PIP quarters, and we want to ensure that we're reaching out to you with the information, but also the topic areas that you'd like to have covered. So please, if you've got a moment, just to complete that evaluation there with that QR code. We'll also be sending out an event, a post-event email, which you'll receive early next week. It'll have a copy of the recording of this webinar, also a copy of this new cancer cervical screening toolkit, and samples of the PDSAs that we may have, and also some of the resources that Barb has referred to throughout the presentation. I just want to
one question. Sorry,
yes,
Ange. It was just someone asking if we could provide the instructions for using pen, but unfortunately we don't actually. Our PHN uses Polar, so you will need to contact your own PHN. I'm sure they'll be able to provide you with instructions for getting that information out of PenCS the same.
Thanks, Barb. Just as Barb mentioned, we're running some really fantastic training opportunities for practice teams. There's best practice training and medical director training. And as Barb said, they'll also include demonstration of the cervical screening processes in those demonstrations. We can go directly to our website under events to then scroll through and find each one of these, and note that there is different events for different people within your clinic. So specifically for doctors, nurses, and practice managers. Also, just a reminder for practices to pass on to your GPs that our team here at the PHN are offering initial assessment and referral for mental health care training for GPs. There's a $300 payment available for eligible GPs to complete this 2-hour training. There is training available either online or, depending on the group of GPs that are available to be in training, they do sometimes come out to the clinic as well. So please reach out to our team for more information. Please use that email there, or register using the QR code as well here. And lastly, just as I mentioned, if you would like some further information or just some support in this area, please reach out to either our quality improvement and digital health team. Your general practice facilitator is always there to assist. We work very closely together with our general practice team, with Julie and her colleagues. So please reach out to them. And also, if you'd like to be linked up and using Health Pathways, there is a direct email there for our team as well. So on that note, I want to thank you. We've actually finished a little bit early today, which allows you all to get back to your busy days, I'm sure. Thank you very much for your time, everybody. Please keep an eye out for those emails and resources coming out to your way early next week, and have a great afternoon, and we'll see you next time. Thank you.